Caesar, sister, Caesar, wife. Please, my mother, drop your knife. It can result to a loss of a life. Do not violate a right. Oh, my daddy is a right. Do not force that to an ally.
Good day, viewers and listeners. My name is Mariama Jom. I am happy to welcome you to our virtual learning class on gender-based violence. This program is brought to you by the Network Against Gender-Based Violence in partnership with ActionAid International, the Gambia, funded by Amplify Change. Class 2 will be presented by Sadio Kamara, who will take us through the intersection between COVID-19 and gender-based violence.
Hello, viewers and listeners. My name is Sadio Kamara. I work for ActionAid International, the Gambia. Before I start my main topic, I want to talk about COVID-19. Coronaviruses are members of large viruses that cause illnesses to animals and humans. In humans, several coronaviruses cause what is known as respiratory infections, ranging from common cold to more severe infections known as the masses and the verses. The most recently coronavirus is the COVID-19, which was unknown before the outbreak in Wuhan, China, in December 2019. The COVID-19 today is a pandemic, and it has affected many countries in the globe. When it comes to GBV, it's a violence that is directed to a person based on the person's sex, being a male or a female. And some of the type of violences here are physical. You have the economical violence, the sexual violence. You also have what we call the harmful traditional practices. Now we look at the topic. During emergencies, girls and women experience the outbreak differently than boys and men. Women and girls face specific risks and vulnerabilities because of deep-rooted inequalities and traditional gender role. If you look at our traditional gender roles, women are subjected to subordinate positions in the family and in the community, while the men have the upper hand. And because of that, there are some inequalities. That is why during emergencies, women and girls face specific risks and vulnerabilities. World Health Organization estimate over 35% of women globally will face sexual or intimate partner violence in their lifetime. Already, countries like Italy, like China, USA, UK have already suggested a rise in GBV. During emergencies, levels of different forms of GBV may grow, more acute due to the broken social and protective networks and lack of services, which create an environment where women are at high risk. Yes, this is because recently or during the pandemic, most of the services are directed to a response to COVID-19. GBV and COVID-19 introduction. Due to social role of women, they provide care, services at home, because most of the time it is the women who are doing the cooking, they are the one taking care of the sick, looking after the children, cleaning, washing, and water management. That is why it is important during these trying times for everyone to join hands and not to leave the household chores to one person. Women are mostly among frontline workers in the health sector. Some studies have even shown that 70% of health workers are women, which means they are in direct contact with suspects and infected persons, and that is why their life is at risk. Stress is one thing during the lockdown. If you put somebody at one place, somebody who was moving freely, and now he is just sitting in one place, that alone is stressful. If that person is out of work, it means he is also encountering money worries. The lockdown, therefore, is increasing the likelihood of violence against women and girls, because most of the time they're the one in this situation of poverty and they have to depend on their male counterparts. So women and girls with survivors are also forced to stay home with their abusers. During the lockdown, things are also slowed down, especially the economy, which will compound unable status of women and increase their dependency on men, which further exposes them to other forms of exploitation and abuse. Sometimes it might not even be intentionally, but if you look at it, somebody who used to give fish money, somebody who used to pull out money whenever you ask, now that person is not going to work and does not have means to get money. If you ask the person, sometimes he can get agitated, and that can lead to abuse. That is why women are normally exploited, because of their position when it comes to economy. For example, employees in the hospital or the industry, most of them lost their jobs, and if they are without alternative skills, they will not be able to earn income. Women and families that depend on remittance will be hard hit if the migrant family members loses his or her job. And that's a big problem, because if you looked at the Gambia, most of our families are depending on remittance. So if that particular person who used to send you money is no more working because of the lockdown, it means that will affect you harshly. The school closure increased the child care burden of women. Now that the children are no more going to school, the women need to do more cooking, they need to do more cleaning, they need to do more controlling of the kids. Maybe they'll be cooking at the same time they will want to guide the kids when they are attending their TV classes. So the burden is increasing on them. Children, especially girls, may be exposed to different forms of violence, including sexual and physical violence, and also child marriage. In this period of the pandemic, now that there is lockdown, most of the time it is the girls who suffer. They can also send this girl child to marry now that there is no school, because maybe the parents are not rich, and there is this wealthy man around the corner who will just come and say, okay, now these girls are not going to school, why not you give her hand to me for marriage? So those are some of the issues that might affect the girl. But remember, we have laws binding those things. There are laws surrounding early marriages, so it's prohibited. We should avoid it. Physical violence can also happen to women, sexual harassment and all those things, especially if you're sending your girl child to lonely places during this lockdown period. Some girls are at risk of FGM, as the practice can take place in closed doors. Now that there is no social events, everywhere is quiet, they can just say, okay, let's take the child. Let's do this FGM. Nobody will know. So they'll be doing it in closed doors. Please, let's be mindful. There are also laws that are against FGM. If one is caught doing it, you are liable to go to jail. So please, let us do away from that act. During this lockdown also, there is increase in women care work as many people stay home. And the tendency of eating more and dirtying the home, more frequency requires the need for more frequent cooking and cleaning. Please let us join hands and support one another. One person cannot do it alone. A woman who is cooking, washing, cleaning, and at the same time want to take care of the kids will be a burden. On top of that, looking after the sick. So please, let's all share the household chores. The lack of reliable source of water also put women at risk of going out to search for water. In some instances, women have to walk for a lot of kilometers just to get water. In the process of fetching water, they can be attacked by unscrupulous people, and in the process, their rights can be violated. So we need to be mindful of that also. In most cases, without adequate water and sanitation, may be locus for the spread of the virus. Now that we are saying that people need to wash their hands frequently, people need to clean their environments to prevent the coronavirus. So lack of water may be a room for the virus to be spread. So women are trapped with their abusers in the same room. Like the saying goes, once abused can always be abused again. So if your husband, who is always abusing you, used to go to work, it means there is some time between he goes and come back. Then you gain time and do your other things and then be free from abuse and violence. But now that 24 hours you are together in the same room, abuse can rise. So because of that, we are appealing. If you are a victim of that, please do not be silenced. Speak out. Slowdown in transport system can also affect survivors reaching out to the police or health centers. Because of the circumstances we are in now, it is difficult to get transport sometimes. And because of that, the victim might be delayed to get to the police station or to the health facilities. And we can lose evidence in the process. Now we look at the emergency responses. Women mostly have unmet needs with emergency responses. This is because there is high concentration on response to COVID-19, leaving other services understaffed. So what we need to do here is, when we are coming up with plans for COVID-19 responses, we should always include needs of everybody so that we will not leave anyone out. Because what we need to know is women also have their different needs, just as the men have their own needs. Needs like contraceptives, needs like sanitary pads, all these things need to be factored, even baby foods. For example, management of rape cases and follow-up may not take place, or reduction of the staff from the antenatal care services to focus on the emergency can take place. Health workers trained on GBV management identified to be part of the COVID-19. That can always happen. During this COVID-19, there are already health workers who have been identified and trained on GBV to be addressing GBV issues, can now be identified to be part of the COVID-19 team, which means less services for the survivors of GBV. The response package is likely not to include sanitary pads, dignity materials, and baby food, which are essential needs for women. Just as I was saying, women also have their different needs. They have their different aspirations. So whatever we are doing, whatever plans we are coming up with, these things need to be factored in so that nobody will be left out. The court sittings slowed down during the COVID-19, which posed risks of justice delayed or denied for survivors, victims of GBV, including rape victims. Normally, when the proceedings of the courts are too long, it can even discourage the victim and the person can withdraw, which is not good for the survivors. So we look at the social responses to GBV. Normally, some of these response areas are the healthcare services. So health personnel or healthcare services should take care of the GBV victims. You have victims assistance services. We have the network against gender-based violence. We have the social welfare, Department of Social Welfare. We have the Women's Bureau. When it comes to the children, we have the CCPA. All those things are in place. And we even have police trained on GBV issues. So already we have victim assistance services. Working with perpetrators, it is very, very important that we engage them. Since they are the abusers, they need to understand that what they have done is wrong. They need to understand that it is violating other people's rights. They need to understand that it is punishable. It's a punishable act, so they should not be doing it. Media information and awareness campaign, that's another important area when it comes to social responses, because the media have a greater role to play when it comes to creating awareness. Using the local radios in the various regions, using the national radio, using the television. We can also use the print media, even the social media. we can use to ensure that people are enlightened when it comes to GBV issues. So the media, when it comes to social responses, have a very important role to play. Legal responses, we just talked about it here. When you looked at legal responses, in terms of legal, we have a lot of things in place, both structural and instrumental. We have legal instruments like the Domestic Violence Act 2013. We have the Sexual Violence Act 2013. We also have the Women's Act 2010. We have the Children's Act. All those things are here to support victims. And they are all advocating for non-violence. Community intervention is another important area. Before it's reached outside, some of these violences normally take place in the homes, in the communities. Therefore, we should intervene before it escalates. If you're living in a community and you know that there is a man who is always abusing his wife, you as elders of the community should come out and speak up. You should come out and intervene so that it will not be norm in that community. So therefore, the community have a greater role to play. When it comes to faith-based organizations, they should always talk about GBV issues in their sermons, in their Friday prayers, wherever they gather, they should talk about it, because people listen to our faith-based programs. They listen to our priests, they listen to our imams. So whenever they are preaching, they should include GBV issues in it so that we can address the issue. Because already it is a norm in our society. Men believe that, or people believe that, the only way to solve problem is through violence. But I'm saying no. There are other means like dialogue. Let us encourage dialogues. Let us promote dialogue so that we can reduce GBV. So there are some recommendations here. One is to the parents, being vigilant. Always dialogue with children, boys and girls. Normally, there are some parents, when their children come to them to report something, they will break them. They will stop them. They will not listen to them. But I think it's important when your girl child or boy child comes to you to report something, listen carefully. Maybe there is somebody in that neighborhood who is trying to give her something in exchange for something. Therefore, when your children comes to you, be it the boy child or the girl child, please, you as the parents, listen carefully, listen and try to solve what problem the girl child or the boy child have. It is very, very important. Report all cases of GBV during the emergency period to the hotline 199. Let us not be silent over it, because the outcome of these GBVs can be detrimental to our health for the rest of our lives. Victims of GBV normally suffer for the rest of their lives. So we as parents, we as neighbors, we as community members should not keep quiet over it. All GBV cases should be reported through the hotline 199. Stop sending children outside the home, as most places are lonely and children are at risk of being abused by unscrupulous people. It is always a saying in this country, when something goes wrong or when something bad happens, they will say, no, a Gambian cannot commit such a crime. But let me tell you, we have good people in our society, but at the same time, we have very bad people also in our society. So anything can happen, and it can be caused by a Gambian. Because normally some of these abuses are not just happening on the street. Those girls who are walking on the street with skirts normally don't take anything from anybody. Those are not the people they are abusing. You know the type of people they are abusing? They are the people who are at home, the side people, those side children, those innocent children in our homes. And who are these abusers? Normally they are our family members. It might be your uncle. It might be your grandfather. It might be a relative. So please let us be on the watch out so that we can support our children and ensure that they are safe from such abuses. Do not leave domestic chores in the hands of one person. During the lockdown, others should support, including boys and men. So, don't leave the household chores on women and girls only. Because as we are in the lockdown, these chores are increasing. A lot of work. cleaning, washing, cooking. So please, we are pleading to the boys and men to support women and girls when it comes to domestic chores. Watch less of news if it stresses you out. There are some news in BBC, Al Jazeera, you know. If you're looking at this news and they're just talking about COVID-19 and all these deaths, and it is stressing you up, why not you reduce it? Reduce it so that you will not be stressful. Take children for immunization services, and women should not default on their antenatal services. It is important we take our children so that they will be immunized for their health. And if they are healthy, we the children, we the parents, we enjoy it more because we'll have time to do other things. But if your child is sick, you will have to take care of that child. And that can reduce the time you have for other productive activities. Therefore, I'm calling on all mothers, please do not think that if you go to the hospital, you're going to be tested for COVID-19, and because of that, you're not taking your child for antenatal services. Please let us take our children to get their immunizations. Women's protection and leadership must be central to response of plans. When we are coming up with response plans, let us ensure that the needs of women are also included. It is important that health personnel who are women are also part of the response team. Women must be able to report cases during the pandemic, which we have already said, and resources must be available to support the survivors. We should not just say that, yes, we're in COVID-19, all services are geared towards COVID-19 patients or response, but we should also understand that leaving out GBV survivors can be a big mistake on our side. We are calling on government to ensure that access to justice and women protection are central in the response plan since rape and other forms of GBV spike during outbreak. We want to say that during such health emergencies, GBV exacerbated. It increases. Therefore, we are calling government to ensure that whenever there are such cases, it needs to be taken care of. Information can save lives. Therefore, more public awareness needs to be done. Whether it is going to be in reading form, something you're going to listen and understand by all communities across the nation. There should be provision of safe water, safe drinking water, sanitary materials, and hygienic conditions is essential to protect human health during the COVID-19. Just a few days ago, I was watching at the TV and I saw Red Cross pledging to provide a particular community with portable drinking water, because in that community there is only one well and it's an open well, and everybody struggles to get water from that well, and the water table is so low. So it is important now that we need water to wash our hands, to clean our environments. It is important that the authorities provide safe water for everybody and ensure that there are sanitary materials so that we can live in a hygienic condition. All stakeholders should join hands to end SGBV. We should all put our hands on deck. In these trying times, I think this is the time we should employ some of the feminist leadership principles, one of which is self-care and care for others. If you are adhering to the guidelines of World Health Organization, you are ensuring that you're washing your hand, you're covering your nose, your mouth, when you're coughing, you use your elbow. Make sure that your immediate surrounding, the people who are there, you sensitize them to do the same. This is not the time to think about me, but to think about we. So that is one principle of the feminist leadership we should uphold. The other one is the collaborative accountability. That's another principle of the feminist leadership. This is the time we should join heads together. We should join hands together to ensure that we end SGBV. Prevent COVID-19. We should keep physical distance, wash our hands with soap and water. When we are coughing or sneezing, we should use our elbow. Use face masks when going out and dispose properly to avoid contamination. In fact, it is better we stay home if we don't have anything important to do out. If you are not feeling well, coughing, fever, or difficulty in breathing, go to the nearest health facility or call 1025. Thank you.
My name is Mamlisa Kamara, the National Coordinator of Safe Hands for Girls. The global pandemic of COVID-19 presents unprecedented challenges, added burden to families, particularly women and girls, due to their triple roles of production, reproduction, and communal. Therefore, to many women and girls, the lockdown brought about by the COVID-19 pandemic make them more vulnerable to gender-based violence as they spend a lot of time with perpetrators. Thank you.
Sister, 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 wife, please my mother drop your knife. It can result to a loss of a life. Do not violate a right. Oh, my daddy is a right. Do not force her to annihilate my way. Do not